I felt like I was about to die. And I said to the nurse who was taking care of me, I'm sick, I have no reserve, and I don't know how long I can keep this up.
The American doctor who was once near death, stricken with Ebola, is now telling the whole story for the very first time.
And his exclusive interview with the Today Show's Matt Lauer comes on the same day as news that another doctor, yes, another doctor from the same organization now has Ebola as well.
The virus is spreading at alarming rates. So far, the outbreak has caused more than 1,500 deaths overseas, 10% of them healthcare workers. Dr. Brantly and Nancy Wright-Bold were lucky.
A little more of that interview with NBC from Dr. Brantly. As you heard, he talks a lot about what happened before he ever got here. When he was in Liberia, he said he thought he was going to die. He said at one point he could no longer breathe, and he knew that doctors there had no respirators or other machines to do it for him.
Just weeks after his release from Emory Hospital, Dr. Kent Brantly opened up about his first thoughts on realizing he was infected with Ebola. His wife and daughters had just left Liberia to head back to the U.S.
I was so thankful that Amber and the kids were not there. That would have been an overwhelming mental burden if I had woken up sick, laying in bed next to my wife, with one of my children snuggled up next to me.
Then when he did call to tell me he had Ebola, I don't know if I can describe that. I knew what was coming. I'd seen him treat these people who had already been diagnosed, and I knew how it ends. I knew how everyone had ended up.
The director of the CDC, Dr. Tom Frieden, also knows how most people with Ebola end up. He just toured the 3 countries where the virus is spreading. He warns that the numbers of people infected will likely rise dramatically in the next 2 weeks, and says Ebola is not now just an African crisis, but a global one.
The window of opportunity really is closing. I could not possibly overstate the need for an urgent response to get more patients into care, more work getting done in the communities, safer burials. All of these things will begin to get this outbreak under control.
Dr. Frieden also talked about the fact that there is a very small chance, although it is there, that like any other virus, this strain of Ebola could mutate and it could become easier to transmit. He said that's another reason to try to wipe this out as quickly as possible.